You know the drill, questions in the chat, or if you rather raise your hand, that works too. So Sheila was, thank you, Sheila, for posting this very complex question. I actually think it's something I was going to address at some point anyway, in terms of the updated isolation protocols. But as you can see in the chat, it's kind of a multi-section, multi-part question, multiple questions. So I think I'm going to go through all of this, and I suggest that as I discuss it, if you have side questions, just keep putting them in the chat, because you will have, I'm sure you would want certain points of clarification. So first of all, we've talked, I think, some weeks ago that CDC had changed some of the isolation recommendations, which I disagree with. So I do not suggest anybody who's been tested positive to isolate for 5 days. I think that that's suboptimal. That's my personal opinion. I think it's not just my opinion. I think there are a number of physicians who think similarly. So I would say that stick with 10 days, and the 10 days supposed to be from the moment you started having symptoms, assuming that you recovered fully by the time that that 10-day isolation ends. Now, do not use tests as a proof of clearing the illness. I want to be very clear. There was an idea to, if somebody is asymptomatic and then retest. The problem with this logic is very simple. The test may take quite much longer to become negative. So they should really not be used as a measure of being out of isolation. And I just repeat this. If you got positive test with or without symptoms, do not repeat the test as a measure of you can clear the isolation. It just doesn't work that way. The PCR can stay positive for a month, even longer after infection. That has to do with the fact that when doing the replication test, the genetic material replication test, PCR test, you can pick up any pieces of the genetic material flowing around. It doesn't mean there's an active viral infection. It simply means there's still some potentially dead pieces of virus floating around in your system as the disease kind of winding down. So that's important. Now, what are the actual protocols? The protocols are the same. I don't really think that sort of changed as to what quote unquote isolate means. Obviously, if you're isolating at home alone, it's pretty straightforward. I wouldn't see any reason to wear a mask. But if you have other people in the same room or in the same apartment or same house, it gets a bit tricky. It's actually quite difficult, frankly, especially given that you're going to eat in the same place. So the best logic in that case would be that the person who is isolating is isolated to a particular room. When the person comes out of the room, that there's a mask in use. And also you want to somehow try to create either an airflow or air filtering of some sort, but you do need to understand that all of these methods are still probably not going to be perfect. So there's a pretty significant chance for the other person or persons to get sick. The good news is that statistically speaking, it's not guaranteed. So if you have people in your house or in your apartment and you started isolation on time and they didn't quite expose, the good news is that actually if it's done appropriately, the chance is not extremely high for that person. Okay, so that's for that. When you're in a room, I don't think you have to use the mask. It's hard to, I will tell you from personal experience, you can have any kind of recommendation, but keeping mask on 24 hours a day is nearly impossible, not necessarily for the hygienic reasons. I mean, you can change masks and wash them, but the amount of pressure that is generated on the face and the ears and the back of the head is actually quite substantial. And I will tell you that even in 4 to 5 hours that I'm in clinic wearing N95, it's daunting. That's not easy to do. So I think that it's essential that you use a mask at the right time, like when you come out of the room and you go into a common area, put the mask on. And also the persons that are not infected, they should also be putting mask on when you're in the we had a situation where our kids were exposed and we tried to isolate them. That didn't work at all. Just like practically telling you, but they didn't have symptoms and they tested negative, so they never actually had it. They were just exposed to somebody else. And that's actually a good question. Like, should you be isolating if you're known to be exposed? That gets a little complicated. I would say that's a good time to get tested. So if you got exposed, you have multiple people in the house, you are negative, and you repeatedly tested yourself, say once or twice, you don't have to isolate. The timing here is a little tricky. Omicron seems to have very short incubation period, definitely way shorter than the prior variants. So that's a good news in this situation. You don't have to wait for 5 days, I think it used to be, to come out of isolation in this situation if you were just exposed. Okay, I think I took care of that. Temperature. No, I wouldn't take temperature. I'm not sure what it would change, because if you, well, I mean, if you have symptoms, you want to monitor symptoms, and the temperature check can be part of that. If you're symptomatic, I would follow symptoms if they arrive or not arrive. In terms of what eat to drink, I would say, we've talked about this a few times. You want to, if you have no symptoms, you want to have just a very good healthy diet. You may want to boost up some of the flavonoids, vitamin C in a diet. We talked about all that. If you're having symptoms, I think it's a bit more complicated. I would say it really depends on the degree of symptoms. It depends on how you're feeling and what is the expected, or how you're progressing. If you're very mild illness, again, I'd probably just keep with a very well processed, meaning cooked, not bought processed in the store. I'm talking about that you're cooking the food so that it's much easier to assimilate. You want to probably eat kind of a we had a presentation in Ayurveda last week, correct? Or am I dreaming? Am I just imagining that we were?
That's correct.
So that was a very well, I'm sure, positioned. I must have somehow glanced over that because I don't remember, but I have a lot going on, so forgive me for that. Jennifer would have described very accurately why is it important to have warm food, why is it important to have food that's ready to assimilate and it gets processed through the digestive tract quickly, so your energy doesn't get used up for the process of digestion. Okay, question: how do you know when the coast is clear? So okay, that's a relatively easy question. So if you had symptoms, say for 2, 3, 4, 5 days, you're 10 days out from the moment you start getting symptoms, you're feeling no symptoms, it's pretty clear that you're fine. If you want to be super cautious for whatever the reason, you can make that mark not 10 days to 14 days. I think there originally was 14 days, then it dropped to 10, et cetera, et cetera. So I would say some people are using 5 days of no symptoms. Problem with that is some of the symptoms during the COVID are not as easy to, like, it's just, they can linger, and they can linger for a long time. They can be subtle. And what are you going to count them? Like if you're somewhat fatigued, okay, well, is that post-COVID fatigue? Is that fatigue because, you know, while sick, you were not sleeping well because of congestion? Is it fatigue because you're stressed out by the illness? I mean, there's all kinds of reasons. So you can't really use that symptom then as a hallmark of the COVID itself. So I'd say don't use a symptomatic phase, because it's really, a lot of people don't have it, and you need to live your life. So you can't wait till you're totally symptomatic and then plus 5 days. Okay, makes sense, I hope. When to go to the hospital? So that's a really important question. You definitely want to go to the hospital if your oxygen drops. The question is at what point? There's been a cutoff of 90%. So if you're in 80 and anything less than 89, you should definitely at least call your doctor and discuss and consider going to ER. So everybody remember, we have not talked about this in many, many months, that those little $30 FDA approved pulse oximeters devices. Hold on a second. There, you see the mess, right? Well, there's reason though. It's a mess. So I always have one on my stethoscope all the time. Why? I don't know, because I like equipment, I guess. So this is my, you can get the same one for $35 on Amazon. We talked about this. Very good tool. You put it on a finger, turn it on, it measures your oxygen. Hopefully mine is going to be more than, so 98%, 69 heart rate. So that's one big, and obviously if you're really short of
Misha,
breath.
just a quick interruption. Yeah. Just remember that the FDA last year warned that pulse oximeters are less accurate for people with darker skin. Correct.
The pulse, and they actually have a lot of issues in a way that if you have Raynaud's or if your capillaries don't pick up well, sometimes it's quite inaccurate. Unfortunately, the more effective tools, like much more expensive, they actually not so easy to get. And frankly, they still can give erroneous readings. So that's why I wouldn't just monitor oxygen. Thanks, Jan. If you're feeling okay, like I'm not sure what that would mean. If you start having any breathing issues, that's when you want to have one laying around. But having one laying around generally is probably smart. And it's not just for COVID. It's one of those tools that useful because it's also an instantaneous heart rate monitor as well. Okay, so supplements, I don't have anything new to add to that list. If you guys want to hear that list again, it's a long list, but just in short, I'm going to kind of just walk you through our kind of a typical early treatment package, if you will. I'm not going to give you doses. I'm just going to make a list of what usually I recommend to patients, the dosing, the combinations, because you also need to know the patient's story. Some of the things may be not necessarily contraindicated, but at least you have to be careful. For example, if somebody is quite sulfate sensitive or oxalate sensitive, high dose vitamin C and N-acetylcysteine sometimes can be a little problematic. But other things are quercetin, about 1 gram a day, vitamin D, depending on your personal needs, zinc, somewhere between, I would say, 50 to 60 milligrams to 100 milligrams a day. Vitamin C is at least 1 gram a day, probably closer to 2 or 3 grams in divided doses. And acetylcysteine, 600 to 900 milligrams twice a day. Curcumin, the dose varies depending on the strength, probably 2 grams a day total. And then some kind of either nicotinamide riboside and nicotinamide adenoside, NAD+. That seems to help with the recovery phase when it's for the energy to come back. So that's really brief. Wow, that question actually took longer than I even expected. Okay, so can you ask me? Okay, all right, I think, am I done with that or no? There's still more. Okay, yeah. All right, okay, do you have access to the rapid antigen testing? Yeah. Mark, they're kind of all over now. We even have government distributing them at no cost, like kids at school get. I don't know. Jed, are they still getting kit a week and they're supposed to get tested? I fell off that. I think 2 weeks ago they were still supposed to be testing themselves going to school, but I don't think.
Depends on the county.
Depends on county.
I don't think they're giving tests every week now, but tests are supposed to be available through libraries and places like that.
Yeah, so they're kind of everywhere. My problem with this test is they're really not designed to test when patients have no symptoms, and I highly discourage people to just run them because their false positive rate is pretty high, upwards of like 10 to 20%. That means that every 5th to 10th test will be falsely positive. It's going to trigger a whole bunch of extra workout anxiety for nothing. Now, if you have symptoms, the test sensitivity becomes much higher. It's much better. It's way over 70% if I don't get mistaken. So that definitely would be a better test.
Hey,
All right.
Misha, send me a list of the supplements you mentioned, and I'll put them in the email.
Okay. Can I keep going with the questions, and then I'll do that later.
Yeah. Do it afterwards.
Okay, if anyone received K95 from DC, please double check to make sure. Huh. Wow. So that's DC COVID center masks that are crap. Well, that's not good. Okay, well, thanks for posting that. I'm trying to think what we're doing. I think we're buying them for the clinics actually out of Amazon. We found a couple of ones that are okay. What I don't like about all of them that are the ear looped, they tend to be too tight for my ears. So I tend to like the mask that goes this way, like that, over the back of the head. Those are not as easy to find and they're more expensive. I get them from the hospital, but I use the same mask for like weeks at a time. Maybe 5-6 uses or 5-6 days of use, I would say. And then they kind of fall apart after. I don't know what, Benita, I don't understand the question. BA2 in the area? You're speaking language.
What I was saying was Omicron BA2. Is that variant in the area?
Well, I think it's
like in
pretty
the DC
much,
area, or?
I think it's the only one right now. I think we don't have any other ones, no? Or is that, I'm sorry, so that's a subtype of Omicron.
The stealth.
Yeah, honestly, I have not followed that. I didn't feel that it was clinically important because by my understanding, they're kind of similar and they don't seem to have a massive clinical differentiation. So I decided I'm not going to concentrate on that. Correct me if that's wrong, by the way. Janet puts that comment about the pulse oximeter's accuracy. Okay, yeah, NAC is a mucolytic, very good. Yeah, so you have to be a little careful. That's why I'm a little, Janet, I'm a little hesitant putting doses because doses are a bit individual.
Okay, I'm sorry.
No, it's okay. So what I'll do is I'll put the list of doses for the things that I think are universally okay. But you start talking about NAC and some other things on that list. And you can have issues. So you have to kind of advise the patient individually, I think. Okay, poor circulation. Okay, yeah, so the way you do this, that's a great question. Jennifer never asks bad questions. Okay, so what you do is this. Take the device, take your finger, and then you kind of, you know how you, well, if you're not diabetic, you would know that. You know how you're supposed to, like, before you poke your finger, you're supposed to like push the blood this way, like massage finger this way. That's what you're supposed to do. You kind of rush the more blood towards the end of the finger. You can do it for a few, I don't know, 20 seconds, and then you just put it in. If that doesn't work, well, not much you can do. You can try to warm hands up with the hot water. I find that this method of massaging the finger actually works even better. Ashley probably may have ideas about too. Because anybody who's kind of do a lot of clinical work have their own favorite way of doing this. What does it say? If the government send tests hang out on the truck or front porch at freezing temperature? Huh. I don't know.
I think that was a joke.
No, I don't think so. I think it's
really?
I think it's a good question. What is the test's storage requirements? Great question, actually, because that's actually very important. I mean, that's what they do, and if it sits out there, and maybe after here, I doubt it's a problem simply because you're not going to use it out there in a cold. I don't, well, but I actually don't have an answer for that for sure. So somebody will need to look that up in research. I don't know if I'll have time. Elizabeth, If you were in my student class, I'd say, great question, go research this. Can we hand it back to you and say you're going to look it up for the next week? I hate to do this, but I don't know if this may take a while to try to figure out, maybe to a point of even like going to the original test and trying to get their their manufacturing and testing score sheets and figuring out if they even test for the, I don't know. Okay, I think it's good. I think it's 2:25. I don't see any questions. All right, well, Jennifer put a joke in, okay. I think there was one update I wanted to say. Oh yeah, there are a couple updates real quick. So there are kids under 5 vaccines supposed to be approved before the end of the month. And then there's a study coming out of UK showing a rapid decline in the booster efficacy after 4 months to pretty much 0. And basically what they're saying, we're going to have boosters frequently. I will express caution here. I'm going to put, this is going to come controversial. I understand that, but I'm still going to do it. So I'm going to put a link to my YouTube video that I just made with a friend of mine who used to be here, local. She's a professor of economics, but she's her main job, in her job, she assesses quality of research methodology. And so what I want to do is if you guys have 10 minutes to spare, listen to what she has to say. The problem with the current booster, and feel free to subscribe to my YouTube channel because I'm going to keep putting this little tidbits and bits like this regularly, once or twice a week. So the problem is we had original studies which were randomized controlled trials for the Pfizer and for Moderna, but there's not a single randomized trial for boosters. We have no idea how they actually perform against placebo. So the problem here is when you look at the levels of antibodies in the blood, it's a surrogate measure. It's not an actual clinical outcome. And until they actually run the trials, we have a little bit of a dilemma here because we tell the public get more boosters, but we're not telling them what is an actual risk, what is the actual protection based on the randomized data. And that creates a little bit of a tension because of course there is some low chance of side effects and public has to be at least aware as to what is the benefit to the risk ratio. And with that, I see the subtle sign that Janet has. So, well, it's super, well, okay, so introduction. So it's, I can definitely introduce my wife, but you've seen her before. She's going to go after Ashley, but it's super pleasure to introduce Ashley. So Ashley is a new clinical manager, I believe that's the title, at the wellness center that was recently established. Dr. Frame, who's here, is a co-director of the center. So Ashley is a physician assistant and an acupuncturist, and it's wonderful that she will share a little bit of her practice. And today's a little unusual. We have 2 people doing 2 separate practices. So without further ado, thank you, Ashley.
Hi guys, so I'm happy to be here. Just to piggyback a little bit on what Misha said about my clinical experience of taking your O2 and monitoring that, is that the best one to do is an ambulatory ox saturation. So walking in place or even just walking back and forth in your bedroom while you take it is going to give you the most accurate measurement for whether you're safe or not. And that's clinically what people are using in the hospitals and urgent cares currently. But today I'm going to share a little bit with you about Qigong and a little bit of that practice. Qi is loosely translated to energy and Gong is work. So it's working with your body's own energy through your meridians where it's stored to try to get to your optimal health. And the great thing about Qigong is that you can do it on your own. You don't need somebody else, like an acupuncturist, to help you out with it. So I'm going to give you a couple of great tools that you can use, and it doesn't need to be a 30-minute all-together practice. You can just take little pieces here and there that resonate with you and use them throughout your day and as needed. So I'm going to move my chair so I can stand. Best way to do this is to not have shoes or socks on. That way all the good acupressure points that are in the bottom of your foot can be in contact with the floor. And so I'm going to back up so you can see all of me.
Ashley, is it better for people to stand up or should they stay seated?
I think it's better to stand up. If you cannot stand up, it's okay. You can do the arm movements and follow along without the legs, but it's best to stand up if you're able to. If not, it's totally okay. It's your practice. Okay, so I think this is the best way so that everybody can see most of me on the screen. So you're going to, with all Qigong movements, you're going to have your legs hip width apart. You can have your toes pointing forward. If they move a little bit off to the sides, that's okay. Don't pressure yourself. And the way I always start is just with a little stretch. So I interlace my fingers and put them in front of me. And then I put them above my head and stretch up. And it feels really good if you want to put a lot of your body weight on, let's say, your right foot, and then move towards your right side. And just stretch to the side a bit. And then you can come back to the center, put your body weight on your left side, and stretch to the left. And that feels really good. Another one that I really like to do that's a little bit of stretching is using your shoulder to massage your neck. I think this is a place where a lot of people get a lot of tension. You don't want to tense up your shoulder too much and actively use those muscles as not to cause any sort of pain. So if it starts to get really uncomfortable, stop, as with anything else. But you just use it to massage your neck a little bit. It's a more fluid motion than having your neck go all the way around in a circle. It doesn't interrupt the qi as much, which is great. Another one that I think is really good is called tapping Qigong, and I use this a lot when I'm feeling very fatigued. So there actually are studies that look at chronic fatigue and tapping Qigong, and they've been pretty successful to help people combat low energy. And so the best way to do it is to follow the natural flow of the meridians or energy in your body. So generally you start with making little fists. It's kind of like a little Tarzan move. You can hit your chest. These are all really good acupuncture points, all down here in your sternum. And then more outward to your shoulders. This point over here is lung 1. This is an amazing point for things like grief, depression, sadness. All these points in the middle are wonderful spirit points for trauma. So you do that for a little bit. Now when it feels comfortable, don't get caught up in the amount of times you do any of this. It's not important and actually will detract from your practice. So whenever it feels comfortable for you to stop. And then the way you're going to start down is a little bit of a slapping motion. Do it as hard as feels comfortable. You don't have to do it excessively hard. But you're going to go down the inside of your arm, so palm facing up. You're going to follow all these great lung, heart, PC meridians, and then when you go back up, you're going to go back on the outside of your arm. So you're going to slap up. And then make sure you get that upper back because it just feels really nice. So down, inside of your arm, following that natural motion of the energy, and then up and into your back. And you just do that a few times. It really increases circulation as well. So like we talked about earlier, if you want to take that pulse ox, maybe and you have Raynaud's, maybe you do a little bit of this first. So it goes up, and then you're going to go over to the other side. Make sure you're always balancing out on the other side. So all the way down the arm, and then up the outside of your arm, which is going to be your large intestine and your triple energizer meridians, small intestine. outside. Then once you feel comfortable with that, you're going to start in the bottom half of your body. And the way I always start is by doing little fists with my hands and starting on my lower back. This is a great place if you sit a lot, especially. So you just make little knocks on your lower back, whatever feels comfortable for you. And then once you're done with that piece, which I just do a couple of times myself, I slap on the outside of my legs. And if it feels better for me that day, I'll knock with my fists. So all the way down, and then you go on the inside, up. So outside down. And then inside up. This on the outside is going to wake up those bladder, gallbladder, stomach meridians. On the inside, the spleen, liver, kidney. Once you've done that a couple of times, like all Qigong practice, you should take a moment to sit with your body and see how it feels. Not with the intention of change, but the intention of being and noticing. Some people may feel some tingling sensation. You may feel nothing. No judgment. Just notice how your body feels different, if it feels different. It's just giving you information. Do you feel more awake? Do you feel more tired? Is there a little nausea there? That's all normal. So after you sit with that, if you wanted to not go through the entire tapping of your body and you wanted to just focus on your lower back or your kidney area, because maybe you have lower back problems or maybe you're just looking for a big boost of energy, you can do what's called knocking on the gates of life. So you make little fists with your hands and you're going to swing back and forth, hitting your lower back. So it should be a fluid motion. Maybe you've seen people doing Qigong in parks like this. This is a really common one I think that you see a lot. It's also very simple. But you're just going in a circular motion. And it doesn't, again, have to be particularly hard. You don't have to be hitting really hard. Just whatever feels comfortable. But this is a much faster one if you don't want to take the time to do all of the tapping. And you just want to focus on that lower back or your kidney bladder. Okay, so another one I was going to show you guys today was a water Qigong. So water is really significant right now because it's the winter season and water is the element associated with the winter season. So having a deficient water energy may mean that you have low energy or you have weakened bones or your immune system is weakened. Those can be some signs of having deficient water energy that this would be good for. Excessive water energy could look more like anxiety. And it doesn't mean that these aren't good for you. These may help a little bit with some stagnation that could be built up. Maybe you have the energy, but it's getting stuck. And this would help with that as well. But those are some things to look out for that help you know that maybe there is a little bit of an issue or disharmony within that water element. And so with most Qigong, depending on who is the person who instructs it, you're going to be in this Wuji posture. And so that looks like sitting on a bar stool. So it should feel like your bottom is down a little bit, almost like there's this imaginary stool right here. And you don't want to be too far back because then you'll be unbalanced and you won't be able to perform the arm movements and the exercise. So your knees should be a little bit bent. Again, your legs hip width apart, imaginary bar stool that you're sitting on. And usually your arms are out in front of you with your palms facing your palms. And the water one starts with moving your arms up towards your face, which your knees will go up. And then when you go back down into that Wuji posture, your knees will bend. And so it's a forward motion, which is very water-like. Water as an element just moves through everything. If there is a rock in its way, it doesn't move it, it goes around it. Which is the same with what you're trying to portray. You're moving your energy forward. So you should go up towards your face. And it should be sort of a circular motion. Once you feel comfortable with the motion, you can add in the breathing. So as you're going up, you would breathe in. And then exhale as you go down. And it doesn't have to be in time with my breathing, it should be in time with your breathing. And like I said, I particularly do 7 or 8 times, but it doesn't matter. Don't get caught up in the numbers. Your body will tell you when it's done and wants to move on to the next thing. And sometimes, honestly, this Wuji posture can be a very uncomfortable one to be in. So when you're ready, you can stay in that Wuji posture and feel it out. See how your body feels. And there is a little discomfort. It's a little, your legs should feel a little uncomfortable in this posture. But you're really trying to harness the energy of the Dantian, which is a main energy center in Chinese medicine or philosophy. So you're going to sit with that, see how it feels. If you want to sit with it by unbending your knees, because maybe you've had some knee difficulties in the past, that's okay too. Make sure you're breathing. The next one I wanted to show you was compressing the pearl. So this one's also done in the same Wuji posture with your knees bent, sitting on a bar stool, arms in front of you, palms facing palms. This one, your elbows are going to be a little bent, and it's almost going to be, you should have your arms in front of you. It's almost like you're going to be creating a little energy ball. So your arms are going to go up, your knees go up, your arms go down, your knees go down. You're harnessing your little ball of energy. You're bringing it all in, right to that Dantian, right to that center of where all the energy comes from. The sea of qi. Right near your belly button, a little bit below that. And then when you feel comfortable, you're going to match it with your breathing. So you would breathe in to go out, and exhale to go back in. And then I like to sit with it after. And again, you can sit in that Wuji posture. If that's uncomfortable for you, you can stand. Close your eyes. See how that feels in your body. Notice any changes, if any exist. Just be with it. And then, as always, with all of Qigong, there should be a closing out. You don't want any of the energy to sit up here in the upper part of your body. You want to move it down. So the closing out, which is a great thing to utilize just at any point in your day, if you're about to do a presentation or a stressful meeting, or you have a doctor's appointment that you're worried about, this can be a great exercise to do just to ground yourself before those events. So the way that you would do that is you would have your palms forward. Again, you would be in that Wuji posture if you can. You would have your palms forward, your arms out by your side, moving your hands up to your face. Turn your palms in towards each other, almost like you're pushing it down. Once you get to about your breastbone or your bottom of your chest, you're going to turn your arms in and you're going to push down. So again, your legs would be straight for this part. Hands towards your face, pushing down. Once you get to here, your arms change, you push all the way down. So you take a deep breath in. And then exhale, push to the ground. Mother Earth can take it all. This is a great one to do if in the beginning of your Qigong practice, you're feeling a lot of nausea, or you just don't feel good initially. It may just be that there's a lot of stagnation, and that's okay. You just move it down. So once you feel like you've sufficiently moved the energy down to the lower part of your body where you want it to be in this lower dantian, the last thing that can be great to do is called shaking Qigong, and this is just a fun thing to do. You can also do this after you've been in a highly energetic environment, or you feel like there's a lot of contaminated energy. Basically, you're going to shake off almost like you have something sticky on your body, so it's going to be really dramatic. You want to shake it off almost like there's something sticky. And then once you get okay with your arms, you want to add your legs into it. Just get it all off. And that's the end of your practice. So you can feel how your body feels after doing all of that and sit with it for a moment. And then you can feel free to use all of these at any time, out of order, doesn't matter. Thank you so much for allowing me to be a part of your mindfulness experience today.
Wow, that was great. Thank you, Ashley. Excellent. So, and we have a few more minutes, and I was thinking maybe we can do a little bit of a breathing, but do we need to save time for questions, Janet?
No.
Okay.
No, we can go till almost 3.
Okay, so let's see what we can do. So yeah, find yourself sitting comfortably. You can sit. Just allow your body to find the best way to just accommodate yourself in the space. So let's do some mindful breathing. So it's a little bit of exploration. So it's not just experiential practice, but there's a bit of a discussion. So just notice, pay attention to your breathing, your normal breathing. And just notice what happened when you begin paying attention to your breath. Did you try to take a deeper breath? Maybe some people do. or you just found your normal breath without trying to change it. That's interesting. Sometimes we think that we need to breathe somewhat differently from our normal breathing. No, we believe that deeper breath is maybe a more correct way to breathe, or you just notice what happened when you started paying attention. And then we're just going to continue with a very normal breath, whatever it is for you. If you think it's a shallow breath, just keep your judgments aside and just continue to just being with your natural breath. And as we do that, we're going to just pay attention to just a few specific aspects of the breath. Just observing, noticing, learning. So first, notice the volume of your breath. Again, there is no judgment. So it's a sensing practice. It's just notice what's the size of your breathing capacity without labels. Just sense the volume of your, not even lungs, because we can breathe with not just the lungs. It's just kind of way more than just anatomy. So what's the volume of your breath? Just find it. And next, find the depth of your breath. Even if it's shallow, just observe where does it go? Your normal, relaxed, natural breath at this time. And then allow yourself to sense the outreach of your breath. Again, it's not just the lungs. We could reach out with our breath into our legs, into the back, into our arms, and maybe our skin, and maybe even outside of our body. And all of this can change. It's just what we're learning is how it is right now. So outreach. And the next thing, just see if you can find a center of your breath. Again, there is no one place where it has to be the correct kind of way. It could be in the belly right now, could be in the chest, could be in the head, it could be outside of your body. Just be curious. And then just follow the rhythm. What is the rhythm of your breath? Just follow inhalation, exhalation. It's kind of swinging with your breath. I didn't mean body swinging, although you can do that, but just like your breath having the rhythmical motion. So these are just a few parameters. There could be more that we can use to discover our breath, sense it, be with it. be it. And then let's explore a little bit about breath in a state of nervous system. So this is kind of a little experimenting. So allow yourself to take a deep inhalation. Just focus on the inhalation. The rest is whatever happens. Just take a couple deep breath in. And just notice, what do you want to do? Do you want to open your eyes as you do that, or you want to close your eyes? Also sense when you're sleepy, kind of like you need to pay attention. Maybe you're listening to a talk and you find yourself like dozing off. What do you do? Is it something you would do at that moment? Like take a deep breath? So yeah, so just notice what's happening psychologically with a deep inhalation. Do you find it kind of like waking up a little bit, kind of feeling ready for something, maybe alert, maybe like you want to rather keep your eyes open than close? So that's what we can notice about deep inhalation. And then when we pause, even on inhalation, it kind of extends this action. So we inhale, we can even like hold the breath with the lungs full, and that's actually doing something to our sympathetic nervous system and helps us to stay to activate that part of nervous system. So now let's do exhalation. Just allow yourself to exhale a little bit longer, fuller. So inhalation is just regular, whatever happens, and then exhalation is just longer and deeper. And just notice what are you sensing in your body. Do you want to keep your eyes open, or are you like okay to close them? How does it make you feel, this deep exhalation? And then even adding the pause, like you exhale and you just not rushing to inhale again, just kind of staying with the lungs empty. So yeah, just observe again. So I find it's kind of, I would say it's a calmness, it's sleepiness, it's like a dreamy space. I just want to close my eyes. And so this is more acting on parasympathetic nervous system, this kind of breath. And I don't want to get into what actually is happening in terms of oxygen and CO2. It's kind of complex thing that's at play here because we have a homeostasis, and of course they want to be in balance, and but that's kind of in very intricate balance, and this homeostasis is not fixed. It's fixed. It's dynamic. So that's what's important here. So when we do this famous square breath, when we inhale, pause, exhale, pause, all on equal counts, like say inhale 1, 2, 3, pause 1, 2, 3, any numbers. So we're kind of out of time, so I'm just going to finish my conclusion here, but you can practice it on your own. So the idea square breathing is balancing. It's not so much to relax, but because most of us are depleted and we remember about breathing when we're kind of tired or overwhelmed, the square breath tends to be very relaxing, but it doesn't have to be. If we do it at, in the morning, it can be, it can give us a bit of energy too. So that's what I mean by balancing. So it's interesting how we can use this in order to help our body to do what it needs to do at the moment to get a little bit more energy or to calm down and be ready for the breath. And there are other types of breath we can talk about later, like fire breath, that we can do, for example, to really increase energy in our body and do it really smartly at the right time. So taking another breath and never stop.
Thank you. Thank you, Angela. Thank you, Ashley. Apparently it's a pretty marvelous weather. I think it stays till tomorrow at least. If you're fans of Super Bowl, good luck on Sunday. And we'll see you all. Actually, we'll see you guys next Friday. I think I will try. Who's Janet, who do we have next week?
It's going to be Niall McFarlane and Nina Paul.
Wonderful. Wonderful.
And dynamic duo from last month, and they're going to be here with us. So make sure to tell your friends and family.
See you soon.